failure to respond positively will unfortunately leave us with no option but to withdraw our labor power in all the sectors that NEHAWU organizes as from the 10th September 2020. We are listing 11 demands. I will summarize them. The first one is a full compliance with the Occupational Health and Safety Act by all workplaces. The second one is that all infected workers must return to work only when they have completed the mandatory 10 days of self-isolation and undergo a medical evaluation to confirm their fitness to work, and also demand that all managers at the institutional level must closely monitor symptoms of such workers returning to work. In this regard, we call upon the Department of Health to issue a circular explicitly prohibiting managers from preventing workers to go on quarantine if they believe they have been exposed, be it in families or by conduct. Demand number 3, we call on the Department of Health to mandate the daily screening of healthcare workers and that it must roll out a national testing program of non-communicable diseases, as many of the frontline workers actually live with such underlying diseases without being aware, which causes complications and death when such NCDs are only discovered at a later stage. The fourth demand, we call on the Department of Health to engage with the Health Professions Council of South Africa to expedite the application and to review the postponed arrangements for the board exams, particularly for the foreign trained doctors and other health workers, whether South African or not. Similarly, we call on the South African Nurses Council to review its decision on the restriction of the foreign trained nurses. The fifth demand, we call on government to abandon the current decentralized and fragmented approach in the procurement of PPEs as determined by the guidelines on the management of the coronavirus in the public service issued by the Department of Public Service and Administration. Demand number 6, that the Department of Health must review the process of reporting on COVID-19 fatalities in all institutions to ensure adherence with uniform standard as recommended by the World Health Organization. In this regard, we also call on the Department of Health to compel all institutional managers to regularly update NEHAWU and other trade unions on the coronavirus and COVID-19 data, especially pertaining to the healthcare workers in the institutions. Demand number 7, government must fill all funded vacant posts in the public health sector and ensure that we start to build building blocks for the implementation of the national health insurance. Demand number 8, we call on government to implement a risk allowance for all frontline workers for their hard work and the sacrifice of their lives and families during this fight against invisible enemy. This includes honoring the salary adjustment for public servants by implementing the last leg of the PSSBC Resolution 1 of 2018, especially Clause 3.3 as is, with no amendments. Demand number 9, that all COIDA claims be processed in line with the Compensation for Occupational Injuries and Diseases Act 130 of 1993. Demand number 10, the Department of Human Settlement, Water and Sanitation, Social Development, and the Higher Education and Training must implement the settlement agreement signed with the imposed strike actions in 2017 and 2018. We demand that South African Social Security Agency, Independent Electoral Commission, the National Home Builders Registration Council, and the Special Investigative Unit must immediately implement their respective wage agreements of the sectors. In regards to the National Memorial Day, As a build-up to the National Day of Action, the National Union on the 1st September 2020 will be hosting the National Memorial Day across the country, with the main event being at Chris Hani Baragwanath Academic Hospital. The day will be dedicated to the memory of all workers and frontline workers in particular that have lost their lives to COVID-19.